Today I am going to talk to you about heart attacks. In a population of 1.2 billion, do we know that India is already the diabetic capital of the world? Every diabetic is known to have some problems with the heart. That's why we consider diabetes as equivalent to heart diseases. Well, today our talk will focus on heart attacks. What do we know about heart attacks? Can anybody get a heart attack? My answer is yes. Anybody and everybody, whatever the age may be, whatever the risk factors may be, whatever the lifestyle may be, is prone to get a heart attack, predominantly because of our genetic trait since we are Indians. Our food habits and our lifestyle are also highly prone to develop heart problems. What happens when you have a heart attack? The most common symptom is that we may have pain on the left side of the chest, which may go to the left shoulder and the left arm. But not everybody presents with these symptoms. Some other people may just have pain in the center or burning pain in the stomach, pain in the right side of the chest. People may also have pain in the throat and choking sensation. Any pain which is right from the throat up to the stomach or any discomfort should not be neglected. The most important part of treating a heart attack is to identify the symptoms promptly. In any heart attack, we should note that time is muscle. What does this mean? With every minute which passes by, there is loss of heart muscle whenever there is a heart attack. So how much ever we delay after the onset of symptoms, we are prone to have more and more damage to the heart. How can we prevent and treat this? The best way is to identify any symptoms of chest discomfort or back discomfort, whatever they may be, and promptly consult a doctor in a hospital. The first step is to take an ECG. On an ECG, it would be promptly diagnosed whether it's a major heart attack or not. Well, if it is a major heart attack, then we have two options. One is go ahead for an emergency angioplasty. Second, go ahead for emergency injections. Well, emergency angioplasty remains the mainstay of treatment and is the gold standard treatment worldwide. So, whenever you have a heart attack and you're in a hospital which is capable of doing emergency angioplasty, the doctor would always offer you to go ahead for a PAMI or a primary angioplasty. The advantage of a primary angioplasty is that it straight away opens up the block, you put up a stent, and the blood flow to the heart muscle is restored. By doing this, you will have maximum benefit to life. On the other hand, if it is not a hospital which is capable of doing an emergency angioplasty, then you can undergo thrombolysis. That means giving you an injection. Well, in common words, this injection is just like a first aid which helps us to buy some time for doing an emergency angioplasty. Once the pain and the symptoms have settled down, then we can be moved to a hospital capable of doing an angioplasty within 3 to 24 hours, and it is best to undergo the angioplasty within 3 to 24 hours after the onset of chest pain. So my dear friends, for having a long and healthy life, you can just cut it there.